Hi Samantha, I'm Lori, your public health nurse. You're here for your flu shot. There's two options. You can have the nasal spray or the injection. You fit the criteria.
A needle in an arm, a familiar sight in the Public Health Division of Eastern Health, especially during the fall and winter months, in these circles known as flu season. In recent years, a typical season has seen community health nurses administering roughly 5,000 to 7,000 immunizations to the men, women, and children in the eastern region identified as high risk for developing complications from influenza. That number hasn't changed significantly from year to year, so staff has always been able to order the anticipated amount of vaccine and establish clinics to meet the expected demand. Then came January 2014. Requests for immunizations suddenly flooded in from everywhere in the region. The reason, according to Medical Officer of Health Dr. David Allison, originated a few thousand miles away, with a flu season that prompted concerns reminiscent of the H1N1 pandemic.
Out in Alberta, where we expect the season to get going earlier, they also saw H1N1, and it was affecting a population that's not usually affected so significantly by influenza. People became very aware of the situation and very concerned.
At the end of January, the provincial government expanded free immunizations beyond high-risk groups to all residents of the province. Everyone moved into an even higher gear, securing additional batches of vaccine from the provincial depot, scheduling dozens of additional clinics, and ensuring community health nurses were available to meet the extra demand. By season's end in March, Eastern Health community health nurses had administered 22,942 immunizations, 3 times as many as the previous year's 7,303. Managing much of that was Susan Earls, who says if the demand was above and beyond, so too was the staff's response.
By responding to the calls that came in, one of our nurses in the Burin area realized it would be a good idea to make a trip to Southeast Bight by the ferry, and so she brought the vaccine to them rather than have them make the trip in. There were some elderly people there and clients that couldn't access a family doctor there, so she made that trip.
Meanwhile, across the city, the Public Health Laboratory was just as busy, meeting a huge demand for flu testing from physicians on behalf of their worried patients. From October to March, the lab received approximately 2,500 requests for respiratory virus testing, compared to a regular yearly average of 1,520. The Public Health Laboratory was able to meet the increased demand by restricting testing to critical and acute care services and outbreaks, along with other cases, as warranted. As more needles went into more arms, behind the scenes, the public health leadership kept close tabs on supply and demand. Eastern Health's information technology experts jumped in to help develop a new electronic database, and the result was an unexpected bonus.
One of the things when you have these types of seasons that have a high demand for vaccine or for any type of situation, you realize the resources that you need in order to do the job more efficiently. And so now that we'll have the database, we'll be able to ramp up for a pandemic or for a season where there's a high demand on vaccine or any other situation.
We were very pleased with the whole process. Our public health nurses deliver immunizations to such a large number of people. But we also were very pleased with the input we got from other departments. Our information services contributed to designing and delivering a tally system and a vaccine inventory process, and we're going to be able to use that into the future.
Another outcome from last season's hike in flu immunizations is that for the upcoming season, Eastern Health plans to continue immunizing beyond the high-risk groups, targeting more of the general public. But having met a surprise demand so well, Dr. Allison is confident the public health team will again roll up their own sleeves, perform well, and hit their target with precision.